Hello, this is Dr. Dorwitt, and this is the appendicular skeleton. The first bone we're going to study with the appendicular skeleton is the clavicle. In plain English, the clavicle is the collarbone. There are two ends to the clavicle. One end of the clavicle forms a joint with the sternum. The other end of the clavicle forms a joint with the scapula. The side of the clavicle that forms a joint with the sternum is called the sternal end or the medial end. The side of the clavicle that forms a joint with the scapula is called the acromial end because the part of the scapula that it forms a joint with is called the acromion process. The way I remember this is that the sternal end is flat, but it's flat in a sagittal plane. And the acromial end is flat, but that's flat in a transverse plane. The next bone is the scapula. The scapula has an anterior side and a posterior side. The anterior side faces the ribs. It's the deep side. The posterior side faces the skin. It's the more superficial side. The scapula is shaped like a triangle, and the things on it tend to come in threes. So we're going to start with three projections. And what I'm showing you here is a posterior view. We see the spine of the scapula on the posterior view. If the spine of the scapula was anterior, it would be rubbing against the ribs like playing a washboard. That would hurt. So the spine of the scapula is posterior. At the end of the spine of the scapula, we find the acromion process. And the third projection of the scapula is the coracoid process. Coracoid means beak-like, like the beak of a bird. Be careful spelling coracoid, because it sounds and looks a lot like coronoid, and this is a situation where one consonant can make the difference between full credit and no credit. The scapula has three borders. It has the medial border, the superior border, and the lateral border. We always know which one is lateral because of the presence of the acromion process. The scapula has three fossae. Fossae is the plural of fossa. The anterior side of the scapula has a single fossa that's called the subscapular fossa. Sub means deep, and this is the deep side of the scapula. The anterior side of the scapula has two fossae. One is superior to the spine of the scapula, and the other is inferior to the spine of the scapula. The one that's superior to the spine of the scapula is called the supraspinous fossa. The one that's inferior to the spine of the scapula is the infraspinous fossa. These are good names because they tell you exactly what they are. The scapula has three angles. It has the superior angle, the inferior angle, and the lateral angle. And the scapula has two depressions. It has the glenoid cavity, which is found laterally. This is where the head of the humerus fits in to make the shoulder joint. And the second depression is the suprascapular notch, found along the superior border. The humerus is the bone of the arm. Arm means the area between the shoulder and the elbow. At the proximal end of the humerus, we see the head, and then there's two necks. The anatomic neck is immediately distal to the head and is only the very slightest bit more narrow than the head. Technically, that is the neck of the humerus. The surgical neck is the area that is functionally the neck of the humerus. It's the weakest part of the proximal end of the humerus. When the humerus breaks, that's where it breaks, at the surgical neck, not at the anatomic neck. Also on the proximal end of the humerus, we see the greater tubercle and the lesser tubercle. And in between the two tubercles is the intertubercular sulcus. Inter means in between. It's in between the tubercles. And sulcus is a shallow depression. About a third of the way down the humerus, on the lateral side, is the deltoid tuberosity. The deltoid tuberosity got its name from the muscle that inserts onto this bony landmark. That muscle is the deltoid. The deltoid is the main muscle of the shoulder, and it's also the muscle where you receive injections. On the distal end of the humerus are two projections that form a joint with the radius and the ulna. The capitulum is the more lateral projection. Capit means head. The capitulum forms a joint with the head of the radius. The trochlea is the projection that forms a joint with the ulna. Trochlea means pulley, and the trochlea looks like a pulley, although I find that the analogy to the appearance of a spool of thread works very well for remembering the trochlea. At the distal end of the humerus, there are three fossae. There's the coronoid fossa, the radial fossa on the anterior surface, and the olecranon fossa on the posterior surface. Each of these fossae are named after landmarks or the bone that fits into that area when the arm either bends or straightens. The coronoid process of the ulna fits into the coronoid fossa of the humerus when you bend your arm all the way. The head of the radius fits into the radial fossa when you bend your arm all the way. And when you strain your arm out all the way, the olecranon process of the ulna fits into the olecranon fossa. These are several more examples of the situation where a landmark is named after a bone or a part of a bone that's adjacent to the bone. Even though the olecranon process is part of the ulna, we have a marking that's called olecranon in the humerus, the olecranon fossa. On either side of the capitulum and trochlea are epicondyles. There's the medial epicondyle and the lateral epicondyle. The epicondyle are very subtle little bumps. Here are the ulna and the radius. The ulna and the radius are the bones of the forearm. The forearm is the area between the elbow and the wrist. The ulna is longer and medial. The radius is shorter and lateral. Both the ulna and the radius have a styloid process. The styloid process of the radius and the styloid process of the ulna are both located on the distal ends of the bones. Styloid means peg shape. On an exam, it's important to write whether it's the styloid process of the radius or the styloid process of the ulna. Proximally on the radius is a landmark called the radial tuberosity. As is true with most tuberosities, there is a tendon that attaches there. It's the tendon of the biceps muscle. At the distal end of the radius is the ulnar notch. It's named after the fact that the ulna fits in there. At the proximal end of the ulna is the olecranon process. There is another process inferior to the olecranon process called the coronoid process. In between the olecranon process and the coronoid process is the trochlear notch. The trochlear notch got its name from the trochlea, which forms a joint with the trochlear notch. The trochlea of the humerus fits into the trochlear notch, and the radius fits into the radial notch. The bones of the palm are called the metacarpals. The bones of the fingers are called the phalanges. Each finger has 3 phalanges, but the thumb has only 2. The next topic is the carpal bones. Carpus means wrist. When we study the carpal bones, we usually look at the proximal row from lateral to medial, and then the distal row from lateral to medial. This is something that I will go into more detail with you when we sit down at the tables. The mnemonic is stop letting those people touch the cadaver's hand. The S stands for scaphoid. Scaphoid means boat-like. The scaphoid bone is shaped like a boat. Lunate means that it looks like the moon, and the bone represents a crescent moon. The triquetrum is shaped like a triangle, and the pisiform is pea-shaped, pea as in a garden pea. The trapezium forms a joint with the thumb. The next bone is the trapezoid. Then we have the capitate. Capitate is named after the fact that part of this bone looks like a head. Capit means head. The capitate is the largest bone in the wrist, and if the tag is on the capitate, you don't really need the mnemonic to figure out that it's the capitate because it's clearly the largest bone. And the last bone is the hamate. And on the other side of the hamate, there's a hook. It's called the hook of the hamate. And that's how you can tell that that's the hamate, even without the mnemonic. We will continue in the next recording with the lower extremity.